So Dr. DeMeo and Mr. Geary, thank you so much for joining me. I do appreciate your time.
You're welcome.
Doctor, if you would just sort of briefly describe, because I don't think most people are aware of what this does. It's almost a treatment of last resort. Is that right?
It's one of the things we have in our armamentarium to treat wounds. And basically what we're doing is we're just delivering into that wound oxygen. Oxygen acts as a substrate, sort of fuel for the fire to get it to heal, but it also acts as a signaling molecule telling each and every cell what to do, when to do it, and how to do it throughout the different phases of wound healing, which is really important because when someone gets a wound, it doesn't heal uniformly throughout. There are certain parts of that wound that will heal quicker than others, so it's important to have that super oxygenated air into that wound to get that process to happen.
And you've seen success, particularly with people who have wounds that have not responded to other treatment?
That is correct. The way we use this is if the wound hasn't healed within 30 days with standard therapy, then we will use an advanced modality like topical oxygen.
Okay, so Mr. Geary, your company actually produces this treatment, right? Correct?
Yes, yes. I founded the company about 20 years ago, and we were the first to commercialize and promote topical oxygen wound healing throughout America. Frankly, we've concentrated back here in the East, but throughout America, yes.
So your dispute with the health department basically is that they say they don't want to do reimbursement anymore for Medicaid patients because they don't think that there's enough evidence that this actually works.
That's a statement that they've made, although they really haven't defined to us why they want to take this Medicaid benefit off the schedule and take it away from the patients.
So you've sued in order to prevent immediate cessation of this treatment, and you're going to have a hearing in March, right?
Yeah,
so
March
a court
13th.
did allow you to continue treatment while you're having this battle with the State Department.
Yes, yes. The federal judge put a stay in and allows us to continue serving the Medicaid patients at this point.
So is there nothing else? I mean, I guess the health department would say, well, they actually did a study. Supposedly they sent this dossier for review in Oregon. You don't know exactly what they reviewed because they won't release it to you.
Correct.
Which is something that we've seen a lot of from the health department, particularly when it came to fracking. So, but do you have any idea why it is? I mean, have you offered testimony to them or through your other practitioners that this is actually effective?
Oh, absolutely. We presented a tremendous amount of information when we filed the suit. They know what that information is. They've got a copy of that, but we have not had any response from them at all at this point. So we really aren't sure why they're doing this, why they're taking this benefit away from these patients.
Was it expensive?
No, quite frankly, it's rather inexpensive compared to other modalities. And we know that if you take this away from the patients, it's going to be more costly. The patient wound may not heal, okay? There could be complications, there could be amputations, and so the cost of not healing is greater than healing.
Well, right, okay, I was going to ask you, doctor, what happens if these folks, I mean, first of all, how many people are we talking about who are getting this treatment?
Well, since we have been working with New York Medicaid going back to 2008, we have done probably 400 Medicaid patients where we heal the patients. Did a lot more where we reduced the wound dramatically by 70–80%. And we know that of the patient base and the managed care organizations, we've probably done another 600 patients. But we know that the patient base is usually for men 62 years of age, for women 69.
So what happens if this isn't available to you anymore?
It just limits the amount of treatment options that we have for these patients, and they go on to have these chronic wounds. And what actually ends up happening is we maintain these wounds. They're just there chronically for months, days, weeks, years, which leads them to infection, hospitalization, surgical procedures, visiting nurses, and unfortunately amputations.
But there's nothing else that you can do? I mean, there are other treatments that you can use.
There are other modalities, absolutely, like we were talking about. There is a hyperbaric oxygen chamber that a patient can physically go into, but there are certain reasons why those patients can't, absolute contraindications and certain contraindications why the patient cannot go into those chambers.
Okay, so what you're hoping for, you could either win your case at the courts, right, or the legislature can intervene.
Yes, and that's why we're up here today, to talk to the legislature, to ask them to support this therapy for their constituents. And the biggest concentration of these type of wounds are in New York City and the boroughs of the whole state and of the whole nation. This is a major, major health problem. that affects individuals, their families, their ability to get back to work, and it affects the cost of maintaining these wounds that don't close.
They've asked you for more proof, effectively, right? They want you to demonstrate that this in fact does work, and they're asking for a double-blind study.
Correct.
Which you said would be actually not moral.
Right, from a physician's point of view, it's morally hard to do a double-blind study when somebody's coming to you with a wound for treatment and you know that you're giving them a placebo and it's not going to work, exposing them to infection, possible amputation and hospitalization.
Would expose you from a liability standpoint?
Well, that absolutely is part of it as well, sure.
Okay, so I guess the thing is, we're going through in New York this, and you're well aware, I'm sure, this sort of movement to try and contain Medicaid and get more into managed care. I mean, and also we've always been criticized as having the Cadillac of Medicaid systems where we just pay for everything, right? I mean, you don't consider this, and forgive me, you don't consider this like a highly specialized treatment when there are other modalities that can be offered that is something that maybe Medicaid shouldn't be offering?
Well, it's a treatment that is highly successful. Okay, it's not a high cost, high maintenance type of a program.
Well, how much is it?
Well, with New York Medicaid, the cost is about $2,000 a month, and usually it's 3 to 4 months that the patient goes on the therapy until they're healed. So you're talking $6,000 to $8,000. We know the national statistics for cost of wound care of these open wounds. If it goes for a year, it can be $50,000 to $100,000. So it's not a question of cost here that we're concerned about. We're actually saving the state Medicaid dollars, okay, by healing these patients. It's really a question of keeping the therapy available to them so they can get the treatment that heals their wounds.
And those other modalities that we mentioned, they are very costly because they usually involve physician supervision, nursing supervision, transportation issues, that all just add to the cost of these treatments.
Well, right, and that's a point that we should probably make here. You're talking about treatment that actually people do in their own homes?
That is correct.
How does that work?
It's self-administered. The company comes in, it educates the patient on how to do it. It's a very simple process, and they're capable of doing it themselves.
And that you don't have any problems with people messing it up, for lack of a better term?
They're trained on how to do this simple procedure. They take a device, it's an FDA-approved medical device, and they put it on their leg, and they adhere it to their leg. They then hook the device up to a oxygen concentrator, which basically takes in room air, splits the oxygen from the nitrogen, puts the oxygen into our device, and puts the nitrogen back into the atmosphere. So they can do this themselves. It's an hour and a half a day, 4 consecutive days. They can do that themselves, or if they have a spouse that can help, that's fine too. But they don't need a nurse to do this. They do it by themselves.
Just to be clear, this is a treatment that's approved in various other locales, correct?
This therapy is approved by the Veterans Administration of the United States, the Department of Defense, by 19 states' worker compensation programs, and many other private insurance companies.
And they have not explained to you why it is that they've never given you a firm reason other than to question the efficacy of the treatment.
Yeah, and their research group, the Oregon Health and Science University, only went back about 5 or 6 years in looking at the medical evidence. In the last 20 years, or since I formed this business, there have been probably over 20 clinical studies done that show efficacy. There's plenty of information out there for that point. They didn't go deep enough. They didn't do a thorough search to really get the evidence that is already in existence. We don't have the need to have another clinical study to prove efficacy. We're doing a clinical study right now to prove cost effectiveness. And so that's the point that we have to have understood.
Well, and just to be clear, you're not turning people away, right? At this point, you are
Absolutely
still treating
not.
people because of the court decision, and we will revisit this issue in the spring unless the legislature acts before that.
And that's what we're asking them to do.
Yes.
Clear. Okay, Mr. Geary, thank you very much. Doctor, thank you.
Thank you very much.
Thank you very
your
much.
time.
My pleasure.